You know that feeling, right? It's 3 in the morning, a health worry pops into your head, and you just can't shake it. Or that sinking realization that the specialist you need to see is hours away. Well, today, we're going to dig into how technology is knocking down those old barriers, one message and one video call at a time, creating a healthcare system that's always on and always there for you. Just picture it. It's the middle of the night, your kid has a fever, and you're stuck wondering, is this serious enough for the emergency room? And that feeling of helplessness, it's something we all know. It comes from a system where care is basically a 9-to-5 job, but our health concerns, well, they don't stick to a schedule. Now, take that same middle-of-the-night fever, but add this to the mix. The nearest children's hospital is 180 kilometers away. It sounds extreme, but for millions of people, that's not just a bad dream. It's the reality of getting the care they need. So what's the real problem here? It's not that we don't have good doctors or good hospitals. At its core, it's a communication problem. It's this invisible wall between you and the advice you need, a wall that, thankfully, we can finally start to tear down. I mean, just think about it. Every single day, millions of totally reasonable medical questions just fizzle out, unanswered. Small worries that could be solved with a quick chat are left to grow, and sometimes they turn into real emergencies. All because the line of communication just wasn't open when we needed it. And let's be honest, the cost of this old system isn't just about money. It's about the stress of missing a day of work, the anxiety of sitting in a packed waiting room, the guilt of knowing you missed a follow-up appointment. It's the human price we pay for a system that just wasn't built for the way we live now. So what's the fix? Well, it starts by completely rethinking what healthcare even is. What if, instead of just a series of appointments you have to book, it was more like a continuous, ongoing conversation between you and your doctor? And the bedrock of that idea is simple: messaging. But look, we're not talking about your everyday chat app. This is a secure, medical-grade tool. It lets you send a photo of a weird rash or share your latest lab results whenever you want. The conversation happens on your schedule, not just when the clinic is open. But then, of course, there are times when you need that face-to-face connection. And that's where live video and audio calls basically bring the clinic to you. With an HD video call, your doctor can see you, talk with you, and get a real sense of what's going on, just like you're in the same room. And what I think is really smart here is the audio-only option for when your internet is spotty. It's all about making sure care can actually reach you, no matter what. Now, obviously, none of this works if you can't trust it. When you're talking about your health, privacy isn't just a nice-to-have, it's everything. It has to be the foundation. And that's exactly why this kind of technology is built from the ground up with security at its very core. The heart of that security is something called end-to-end encryption. Let's just break that down really quick. All it means is that from the second you hit send to the moment your doctor opens your message, it's completely scrambled into a code that nobody can read. Not the platform, not a hacker, nobody. I really love this analogy because it makes a pretty complex idea feel so simple and real. Just imagine every message you send is put inside a sealed medical envelope. The only 2 people on the planet who have the keys to open it are you and your doctor. That's it. That's the level of privacy we're talking about here. Okay, so let's put it all together. This table really nails the difference. The old way? You have an urgent question at night, you either suffer till morning or you make a stressful trip to the ER. The new way? You send an instant message. A follow-up that used to cost you a whole day of work is now a quick photo from your living room. And that specialist who is a 4-hour drive away, you can now see them on a video call. The whole dynamic shifts from these rare occasional appointments to a continuous flowing conversation. It's a total game changer. But what does all this tech actually look like in the real world? Because the real magic isn't just in the features themselves, it's in how they adapt to what people actually need. Let's walk through a couple of examples. All right, here's a simple one, but it's huge. A post-surgery follow-up. Instead of taking the day off, driving to the hospital, and sitting in a waiting room, the patient just snaps a quick, secure photo of their incision. The doctor takes a look, confirms it's healing nicely, and that's it. What used to be a half-day ordeal is now a 30-second check-in. Or think about someone managing a chronic condition, like diabetes. Instead of just waiting for their checkup every few months, they can share their blood sugar readings right through the app every week, or even every day. This gives the doctor a constant stream of information so they can spot trends early, tweak treatments, and offer support along the way. And this takes us right back to that problem of distance. With a live video call, a pediatrician who's 180 kilometers away can actually watch and listen to a child's breathing. They can see how the child is behaving and give a truly expert opinion.
Suddenly, that distance just doesn't matter anymore. It's like the specialist is right there in the room with you.
So when you step back and look at all this, what's the big idea? Well, it's about something much bigger than just convenience. It's a whole new way of looking at healthcare, one that isn't defined by the brick-and-mortar walls of a clinic.
And this is such a powerful idea to remember. We tend to think that healthcare only happens inside the doctor's office. But that visit might only be, 15 minutes? The real process of healing, of managing a condition, of actually getting better, that all happens in the hours, days, and weeks between those appointments. And that, right there, is the whole point. When you build a system where the conversation between a patient and a doctor never has to stop, well, then the care never has to stop either. It becomes this constant, supportive presence in your life.
So what does this all mean for you? It means that next time that health worry pops up, you don't have to wait, you don't have to travel, you've got a direct, secure line to the care you need right in your pocket. This isn't some far-off future. It's here now, and it's making healthcare more human, more responsive, and more accessible than it's ever been.